You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, smile makeovers. According to my first guest, he says, for many people, if you change your smile, you can change your life. And we're talking about how small improvements made to your smile can make a big difference in not only how you feel about yourself, but how others perceive you. With us, we have North Carolina's cosmetic dentist, Dr. Highsmith. Dr. Highsmith, welcome to the program.
Thank you. Happy to be here.
So for people that don't know your practice, who's the typical patient that you see, and what are the different services you offer?
We don't really have a typical patient. Every case is unique, but a lot of what we focus on is cosmetic dentistry. Say somebody has never liked their smile, and they can come in and have the next day walk out with a beautiful new smile. They can actually eat and chew with that. A lot of dental implants. People that have no teeth, they need to lose their teeth. We can, put things back together so they can chew and eat a steak with teeth that don't take in and out.
Okay.
I'm a general dentist, so we do, regular dentistry as well, but I tend to focus on those kind of things, more complex procedures that I've been trained to do.
Okay. Now, you brought a lot of photos, probably more than anybody on the program, so we'll get to those photos, and I should mention, I'm not trying to side with you, but these are literally like extreme makeovers.
Oh, yeah.
These are complete changes. Now, on the we should mention a little bit about you. Your book, Rejuvenate Your Smile. It's about cosmetic dentistry. It's about why you want to improve your smile. Also, you taught at this Las Vegas Institute.
7 years.
For 7 years. What is that? What is Las Vegas Institute?
You can think of it like Juilliard for dentistry. It's generally regarded as one of the top dental education, postgraduate dental education places in the country, where you learn cosmetic dentistry, but also how to get the bite correct. You can also help treat TMJ problems and give them a beautiful smile at the same time. Because you can have, a nice smile, but if the bite isn't correct, you can break stuff. And we see this all the time. Somebody's had veneers done, and all of a sudden now the teeth are loose, or the edges are breaking and chipping. And if you get the bite correct, not only is it more comfortable.
So the bite meaning how the teeth come together?
The bite's how the teeth fit and what you do with them. And that is hugely important. And it has a lot to do with headaches, jaw pain, TMJ, clicking, locking. People call it TMJ. But basically that means that your teeth don't fit properly, and that can cause a lot of problems that most people aren't even aware of.
Is there a lot of that going on with like veneers? Like people, they get veneers?
Oh, it happens. I redo a lot of those. And so yeah, it happens. If the dentist isn't trained in getting the bite proper, then you can cause a lot of problems. Or the patient may continue to have headaches that they had before because they haven't addressed that. Can I show you some examples of how the smile can really change somebody's appearance? Deanie came in to see us, about 13, 14 years ago, and she didn't like her smile. It's not a bad smile. This is not unusual, but she didn't like it. It was aged, it was worn. She also had some bite issues, meaning she had some jaw pain. She had this pain in the back of her head. She'd tried everything for her. And what we did, we ended up doing a full mouth porcelain reconstruction with her, getting the bite proper for her, and we checked out the bite first before we make it in porcelain. And her head pain is gone, and it's been 13 years and it's still gone. And so, look at the after, as far as this person, look at the difference between, this person looks 10 years younger. You see how she's got a broad smile to begin with, but it looked aged and worn. And look at the difference between the two. It's not only just the teeth, but also you can see it in her eyes, you can see it in the whole way she smiles, the way she carries herself. It's just a different thing. Now, this lady's an actress. She does a lot of community theater, and she shared with me that when she got her smile improved, it freed her up in order to express herself the way she wanted to, because she would kind of hold back. Say she's on stage doing a role, and she was not able to really smile the way she normally would.
She just didn't like her smile.
Well, and that's very common, but it's magnified when you're on stage. A lot of people looking at you.
Okay.
And so she also got younger parts.
I think you said like they're doing selfies on Facebook.
Oh yeah.
And Instagram, like they're.
Yeah. Well, you see a lot of selfies where you're taking the selfie and they're smiling like this, where they're not showing their teeth. But once you've had this done, it's a huge grin. Now, one of the most fun part of this is when they see their smile for the first time. And you think it's like, with the plastic surgeon where they take the bandages off and you get to see your new face or something like that. And this is just at the first visit when we put the temporaries on. So as soon as we've got those polished up a bit, we show them what they look like, and they hold the mirror up. And the most common, thing is just, wow. And they're just looking at it like, I can't believe it. a lot of happy tears. That's a good day. People, they've had a smile they didn't like for many, many years, and in one day, they look in the mirror and they see someone different. Like, how cool is that?
Now, you say people with bad teeth are discriminated against. What do you mean by that?
Well, in an ideal world, that wouldn't be true, but unfortunately, this is, people are people. A friend of mine had knocked a front. She's not a patient of mine. She told me this story, and she knocked her front tooth out, and she was in the process of getting. She went to the dentist. She got an impression made for a little, temporary partial. It's kind of like what they call a flipper, because you can flip it out with your tongue. They're not a lot of fun, but at least it replaces the tooth cosmetically, and you're going to wear it when you go out. And it was a couple of days before this got back from the lab, and so she said it was just amazing how differently people treated her. She told me that people treated her like she was an idiot, and she was just as intelligent as she was before. She just didn't have a front tooth right then. Now, for example, in the movies, if any director would know that if you want to make somebody look like a shyster, basically the bad guy, you don't give them perfect teeth. You give them kind of dark teeth, gray teeth, a little crowded, or if they wanted to look like they're dishonest, they might be overdone, like big, huge veneers. Think of Willy Wonka in the as when Johnny Depp played that role. He had these huge veneers, and it just looked weird. Or I think there's SpongeBob. There was an episode where one of the guys becomes some kind of shyster, and they give him these huge.
He was a salesman. He was selling something,
and you give him this huge fake front teeth. So it's a stereotype that's out there. So if it's overdone, that's not good. But if your teeth just don't look good, people will make some stories about you that aren't true. Okay. So to hide that from you, basically, people just will not smile, so they'll hide it. Now, it's interesting. We've all heard Tony Robbins talk about physiology and psychology, and for example, he'll say that if you slouch and sort of look down all the time, eventually you'll feel depressed. If you're not smiling because you don't like the way your teeth are you going to be happy? You've got that strike against you, because your physiology will affect your psychology.
So if you're smiling, it's hard to be depressed.
Yeah. If you're standing up really straight, it's hard to be depressed. If you're smiling, it's hard to be miserable if you're smiling. So put on.
So these people smile more after you do this.
Put on a happy face. Yeah. Okay. It's harder to do if you don't like your smile. Let me show you another one.
All right.
This lady came in. Did not like her smile. She'd had some old bonding on there. It had been there for longer than it should have, and it's just showing signs of age. So what we did is we did porcelain veneers on her top teeth, and when she saw the difference, this is one of those wow moments where she looks at the mirror and like, oh my gosh, this is what I've always wanted, and you can see how it follows her lip. You can see the eye teeth are not quite pointed. All this is individualized to the individual patient so that it fits their face. And she tells me that my daughters are now my sisters. And I've seen her daughters, and it's a compliment because her daughter's as beautiful as she is. And when you look at the before and after, she definitely looks younger. Now these are porcelain, and so it's very different from the bonding. It doesn't stain, they don't chip. Think of like your grandmother's porcelain teacups. It had 8 zillion cups of coffee in it. Yeah. You wipe it out and it's white. So you brush your porcelain and the stain comes off. So you don't have the staining issue with porcelain, which is why we don't really do the bonding so much anymore. Let me show you another one.
All right.
This wonderful lady came in. She's a public speaker, and you look at the smile. This is like not unusual in anybody that's over 40 or 50 or so. The teeth are kind of worn. They're kind of yellow, and it's just the natural aging process that it happens to everybody. Now, and you can see how she's smiling. She's not really projecting a big smile.
Holding back a little bit.
And so, one thing she told me something very interesting is that a psychologist years ago told her that when you love somebody, you show that love for them when your face lights up when they walk into the room. And so she was kind of holding back. She might hold her hand over her mouth, and she said she really didn't express her value of other people by not being able to smile. And so look at the after. Look at the difference in the smile between the before and after that. And so that is, that's quite a difference.
Doesn't look like the same person. I mean, it's really a big difference.
Yeah. And you can imagine if she's doing a speech, the difference that makes in her self-confidence.
Like the credibility. She looks more credible. I'm not trying to side with you, by the way. Yeah. But when I look at these, because look on the phone, you were saying, Randy, a smile could really change somebody's life, or a smile could make a big difference. And I'm a little skeptical. I'm thinking it sounds like a bit of an overstatement, but I think here it does change the appearance.
Look at the difference. It's life-changing. Absolutely.
Now, I told you on the phone that here in California, where we're taping this, that I feel like I could spot veneers walking down the street. They seem to be big and bulky. I don't see that in here. is this, when I see big bulky veneers, is that in the hands of the dentist, or is that what the patient wanted? Combination of both? What's your take on that?
Probably a combination of both, but sometimes patients will say this is what they want. They'll bring in a picture from a magazine of somebody with big huge teeth, and like it's our job to kind of tone that down a little bit and show them what a natural beautiful smile can look like in their face. And so we do that with temporaries. So when we shape the teeth, we put temporaries on there, and you wear those around for at least a week or so.
It's like a trial smile kind of thing?
Yeah, and so you want to make sure you go to a dentist who does something like this so that you get to wear it around the block. If you got an expensive dress, you're not going to take it home without trying it on. This is a way of trying on the dress. You want to make sure that the color is right, too light, too dark, just right. How's the size? How's the shape? Are they too long? Are they too short? There's a zillion little judgment calls in how teeth are shaped. They're not all shaped the same. It has to fit your face, has to fit your personality. So the dentist actually needs to know you a little bit and get an idea of what you're looking for rather than having them all look the same. And you see that a lot.
So there's a lot that goes into the design. You're part of that whole process?
Oh, yeah.
So you when they're there on the consultation, you give them examples of what it might look like?
Yes. And we have a lot of photographs like you see here. If you're seeing someone who says they do cosmetic work, you want to make sure you see photographs of what their work is. A lot of times there'll be pictures on the wall, but they're generic. They bought them online. And so it needs to be their photographs of their work.
So you have to look at the work.
Oh, yeah.
So you're part of this organization, this AACD. What is that?
It's the American Academy of Cosmetic Dentistry. And it's basically an organization devoted, as it says, to cosmetic dentistry. They have an accreditation process in which you present your own cases. There's a written exam, there's an oral exam. You present your cases in which they have these examiners who are like the most picky people on the planet.
Okay.
And you've got this case blown up 6 feet wide, and they're trying to find anything wrong with it they can. And so going through that process is rather lengthy, costly, and intimidating. Most people that start that process don't finish it. In North Carolina, I think last I checked, there were like 6 people who were accredited.
Who've been through that?
Been through that.
It's probably like 3% of dentists in the world?
Oh, way less than that. There's something like 300 in the world.
Oh, is that right? Okay.
So out of, there are 180,000 dentists in the United States. So
find a dentist if you're going to do this, right?
It basically shows that person has demonstrated that they know what they're doing. They've had a lot of training and a lot of experience, and then can produce the result that you're looking for. And they have a website, aacd.com, where you can find out, find people who are accredited.
Or they could go to you.
Or they can go to me.
Or they can go to you.
Yeah.
Especially so what else? We have time for a few more photos.
Okay. This young man came in. He was a piercing artist. And he told me later, and it was fortunate that I was the only dentist that he had not bitten. So he came in, and this is a good example of when you look at something like, it's almost like bringing it back from the dead. Looking at the teeth, your first thought is, oh my gosh, these are going to be dentures. But he didn't want to lose his teeth, and there was something there to work with. So we were able to save those teeth and give him a nice, beautiful smile.
Wow.
And
now those look like regular teeth. What are they? Is that veneers?
Those are porcelain crowns. Now, after he had his teeth done, he went to nursing school. So, which is something he never would have had the confidence to do before with a smile like that. And so talk about a smile being life-changing. That's a great example of that. One thing, this also increases your trust and credibility. Imagine like, at a job interview, which person are you going to hire?
He does look more trustworthy.
Yeah, not only because of the teeth, but typically, of course, we made him smile in the other picture. But when you have a smile like that, you're not going to smile that much. It makes a difference. It's not just the teeth; it's how you feel about it.
You say it's life-changing, like transformations in one day. You believe
this?
That?
Yeah, we see this all the time. We see it in their eyes when they see their teeth. We hear it in their stories when they come back in and let us know what their life is like after we've done their smile. So it is huge. This is an example of where a small change can make a big difference. This young lady is a singer. She's on stage all the time, and she's got a couple of things wrong with the smile that she didn't really like. That black filling, the little gap there.
Yeah.
All we did was fix the filling and close the gap, and she's even more outgoing than she was before. And she loves her smile. I mean, she was gonna smile before, but as far as when you're on stage singing, you don't want to have anything that holds you back. When you're dealing with the public or dealing with people, if there's anything that's holding you back, do something about it. Why not? It can make a difference in your life.
Now with her, because it was interesting, you say a lot of these people have hated their smile for like 10 years, 15 years.
Oh.
Are events trigger them doing something about it?
Sometimes they are. Sometimes it's, sometimes it's a divorce. Sometimes it's a new girlfriend. Sometimes it's the grandkids saying, Grandma, why are your teeth so yellow? This guy is a healthcare professional. A lot of wear on his teeth, and this is not uncommon.
That's got to be unusual, though.
You never see it. We see it all the time. It's unusual to you because people that have a smile like that don't share it with you. They're not smiling. They smile like this, and because they're covering it up. Now look at the after. So now that we put porcelain on his teeth, we actually build up upper and lower teeth. So this basically we did his whole mouth in porcelain, and we were able to build the teeth up to normal size. And has made a huge difference in just, look at the smile. Look at the confidence that he has.
I mean,
he's smiling before, but you can see the difference in his eyes. That he likes this a lot better. And it's much more comfortable for him too.
Were those teeth just small before, or they're worn down?
They're worn down. They're worn down. And it happens all the time. Where if it happens slowly, patients think that this is just kind of normal.
So in the after, these are veneers. I mean, they don't look like veneers.
Those are porcelain. You can see it makes him look more sophisticated. And he's an educated person to begin with, but he looks more educated with the better smile.
It's true.
So let's do another one.
All right. You have a lot of these photos.
I do. Oh, this is just.
Did you bring all the ones you have, or you have a lot more at the office?
Oh, there's a lot more.
Okay.
But wait, there's more.
Wait, there's more.
All right. Now, this lady comes in, and just like the other one, she did not like her smile. She had kind of an underbite. It was similar to the other one. It was worn. Made her look a lot older than she is. The teeth didn't come together very well. She had kind of an underbite, and we were able to fix that by getting her the way the teeth come together, the bite, by taking care of that. It's a more comfortable bite, and it's a prettier smile. And so just look at the difference. Look at her eyes. Look at how she's smiling differently. Now when she comes in, she's smiling ear to ear, and it's kind of like when we unveiled this the first time. She looked in the mirror. I mean, that's another one of the wow moments, because you go from this to this in one day.
Do you ever get excited, like for example, the consult, and maybe they're giving you their hard luck story about how they don't like their smile?
Yeah.
Do you see the end result? Like, do you think, boy, this is going to be good?
Oh yeah, and it's a lot of fun, and it's kind of sometimes hard to hold back because you can see, oh, this is going to be great. I can do wonderful things with this, and so and also I can see how their life will be improved. So
like they don't even know how good it's going to be.
I know, and sometimes it's hard to kind of tone down the enthusiasm because it's like, oh, we can fix this. This is great, and so
you have to tone it down a little bit.
Yeah, you can't get too excited, but it's important for them to know what their options are. It's my job to let you know, well, we can do this or this. Here's how it can look. Here's some examples of cases we've done just like yours, and you can have the same result.
Is this one of those things where people say, I should have done this a long time ago, like a woman like this?
Oh, I hear that all the time. That is a very common statement after having this done. So, wow, why didn't I do this 10 years ago? And we hear that every day.
They said that, where were you my whole life, Dr. Highsmith?
I was right here. I've been here 30 years. Yeah.
Okay, good.
Now, this lady, the teeth aren't bad.
It's a pretty good smile, though.
Well, she didn't like it. So the only person that counts is the person whose smile it is.
So when you look at that, what do you see that you could fix on that?
I see the wear, I see the color, I see it just looks straight across, and it makes it look older than she is.
Okay.
And one thing that she told me after having the new smile is like, well, I know I'm getting older, but the smile is staying the same. The smile is, keeping me young. And so that's, she loves that.
Well, she looks great in the after. It's very nice.
Randy, you said that you can spot veneers in Malo. Do those look like veneers to you?
No, they don't. They look like really nice, clean teeth.
Yeah, that's the thing with experience, like AECD accreditation. They should not look fake.
Is it more art than science when it comes to veneers?
It's a combination. The art is a big part of it.
So is it more art or more science? I mean, is this one of ththose things where the dentist has to have an eye for this?
Well, yeah, you have to. It's a combination, but in the real cosmetic work, the art is huge. I mean, it's because it's sculpting. You're sculpting three-dimensionally, and it's also
you're a sculptor.
Yes, I've done a good bit of that as well.
I've looked at some of your photos. I don't know if we can show. I guess we can on the show. Who's this?
That's my wife.
Okay, so you sculpted her face?
Yes, I did a bust of her in clay, and the other one is Apollo and Daphne as a bronze sculpture.
That's not a mold of her face. You just do it freehand?
No, that was done freehand.
Is that right?
Okay, but I love working with my hands. That's how I got into dentistry. I was doing enamel, cloisonné enamels in high school, and I would sell them in craft stores, and then I'm trying to figure out, well, what do I want to do with my life? And so that's how I ended up going into dentistry, because I could combine the art and science. I enjoyed science as well, and I enjoyed the art. And dentistry is a great combination of the two. It's arts and crafts.
Now, somebody that's had the training, you were a clinical instructor for cosmetic dentistry, wrote a book on cosmetic dentistry, you got great photos. Does it cost more to go to a cosmetic dentist like you?
It doesn't have to.
Okay.
But also, think of, get it done right the first time, because I redo a lot of stuff. And so if you do it once, pay for it once, and then say you're unhappy with the result, and you have to get it done, and, what does that cost?
Yeah,
that's not a good thing. And, we do that a lot.
All right,
and
so time for a couple more.
Okay.
Not to rush you or interrupt you, I just want to let you know that we are short on time.
Here's another one. This lady did not like her smile. She's got this one tooth she keeps gluing in with super glue.
Really?
Yeah, and she didn't like all of them, but especially that one. The back teeth were not comfortable, they didn't fit together well. And she's a cardiac nurse, and she's in an area where she's dealing with people under very stressful conditions, and it's her job to make them feel better. And she's trying to do that, and she doesn't feel good about her smile. So what we did for her, we did porcelain upper and lower teeth, and got her bite balanced, and got her smile the way she wants it. And look at her, there she is with her dog. She's, she's doing much better. She has much more self-confidence. She gets compliments, and now she's into scuba diving. And so it's one thing. It's like, if you don't feel real confident about your teeth, are you going to be confident about holding a regulator in your mouth when you're 100 feet under the water?
All right.
So she's loving that now. Now this young lady, that's not a bad smile, but she didn't like it. They're a little yellow, there's some staining, there's some spots here and there. She didn't really like the outline of them. And so what we did for her is we did thin porcelain veneers on the teeth. And you can see how the two front teeth are a little bit big, the canines are a little bit pointy, and all that's sort of smoothed out and evened out. And so she has a much more beautiful, much more sexy smile.
It's a very pretty smile, yeah.
Now she owns a restaurant, she's with the public.
All because of her teeth.
Well, no, but that's a part of it. It's a part of it. It's a confidence thing.
Because your charisma has changed.
Yeah, it's a confidence thing. It's how you feel about your smile. Many people will be happy with that smile before, but she's more confident with the new smile, and she loves it.
So when should somebody then take care of their smile or get some cosmetic dentistry?
When it bothers them.
All right.
As soon as you find out that it's holding you back, as soon as you find out that you're not sharing your smile as much as you normally would, when you discover that your smile doesn't mirror who you are inside. And that happens a lot. Say if you're not smiling, people might think that you're unhappy or grumpy, and I'm not, I'm happy. So have your smile show who you are. And as soon as you realize that, that's the time to do something about it. Why not? Do I have time for 3 more?
Okay, three quick ones.
Okay, all right. This lady came in, look at her smile.
All right.
And just like the other ones, worn, looks older than she is. And she also had some significant jaw pain issues. So it took a while to get her bite worked out. She worked in conjunction with a chiropractor to get her bite leveled to where things are comfortable for her. We got that where everything feels better, and then did upper and lower porcelain. And you can see on the after what that does with her smile. I mean, look at her eyes. She's much more comfortable, and not only physically, but also emotionally as far as with the smile. So people that also have a TMJ problem, we can not only fix their bite and make them more comfortable, but also give them a beautiful smile, more self-confidence. Just like we talk about with the other pure cosmetic cases, sometimes it's a combination of function and cosmetics. Because if it's in the right place, it works better. So it's a combination of the function and making it beautiful at the same time.
And it really has changed her appearance. I mean, when I look at her before, she looked like a pleasant, nice, kind of a grandmother. Now she looks like she could be the CEO of some tech company. I mean, she looks, I mean, it really gave her like a more youthful look. I think everybody would agree with that.
Yeah, the self-confidence is huge. That's a common thread with people that had this done. They tell me, I'm just much more self-confidence, much more confidence in my smile. And it affects their whole life. So here's another one. All right, take a look at that smile. Not bad, but she didn't like it. It was kind of dark, kind of worn.
You couldn't just do whitening with this one?
She tried whitening, and whitening doesn't always work for everybody. Okay. But no problem with trying. You can go to Crest and get some Crest white strips. That's not a problem. But if that doesn't do what you want, then you may have to look at the next level, such as porcelain. So we did porcelain veneers on very thin, conservative porcelain veneers, not crowns on her teeth. And you can see the way that follows the lip line, where the eye teeth just have the right amount of point to them. It fits your face, and the color is not too white. A lot of times people will come in and they may say they want this like toilet bowl white shade, and really try to talk them out of that. But that would look horrible in her. But that shade fits her beautifully, and she looks awesome. Now this lady, worn teeth, also jaw pain, some head pain issues as well. This lady did not like her smile, just like some of the other ones, kind of worn. They looked older than she is. thin, kind of dark, kind of worn. She'd ground her teeth down a bit. And so when I looked at it, I knew we had something to work with, so we could have a dynamite final result with this. She also had some head pain, some jaw pain as well, so we got her bite corrected as well. And with the after, we put porcelain upper and lower teeth, got her a new bite, and a whole new smile. See the way it fits her face. It follows the lower lip. The eye teeth, look real. Now look at the difference. I mean, she's smiling before, but it's a totally different smile in the after.
Yeah.
Not only the eyes, but the whole face lights up when she has confidence in her smile. And that's just what this is all about.
So you, like for example, when I look at this after, like the curves or the pointiness of the canines, this is all designed by you?
This is all by design. And
okay.
We try that in a trial smile first to make sure that we both like the way it looks. And then once we approve that, then the final porcelain is made. But we don't give the lab the final orders until you wander around the block for a little bit of time to make sure that it fits your face, fits your personality, you like the color, and then we send it to the lab and tell them to make the final porcelain.
So we're out of time. You even have more photos like this on your website.
Yes.
Plenty to choose from. Final message to somebody watching this, they don't like their smile. Right. But look, nobody likes going to the dentist, right?
Well, yeah.
So what's your message to them? They don't like their smile.
Do something about it.
Okay.
Why not? We have the technology. It lasts a long, long time. You can see what we can do, and we could do this for you.
So when you see people that it's obvious they have money, let's say they've got an expensive watch, they're driving an expensive car, but they have this older, worn-out smile. Is it their fear of the dentist that's keeping them from doing it, or not really realizing how important the smile is? What's your take?
It's some of both. Fear is a lot of it. A lot of times people had a bad experience when they were young. They had a bad experience with a dentist. They got beat up by a dentist when they were a kid. But we have sedation. We have ways of getting around that. We can do oral sedation. We can even bring in a medical anesthesiologist to knock you out.
Have you done that before? I mean, for certain people.
Yeah, we have a relationship.
So for the dental phobics, they get a sedation pill.
Oh yes.
And they're fine.
Oh, it makes a huge difference. When you do that, you go home, you go to sleep for a couple hours, and you wake up, you kind of remember bits and pieces of that, and it was not a big deal.
Now, we haven't even mentioned, I mean, you're big on technology. You've written a book on cosmetic. I mean, you have like 4 lasers in your practice.
I'm a geek. Okay.
Okay.
Yeah.
So you have all the new stuff.
Oh, yeah. But the technology makes a lot of this easier, more predictable, faster, easier for the patient, and it gives us better results. So, why not?
Okay, good. I want to thank you for coming on the show.
Thank you
Good
much.
stuff. And we're going to have you back on the program also talking about no more dentures, because you do a lot of dental implants in your practice as well. So
absolutely.
Thanks again.
Thank you much.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.